Hey, it's Ian from WorkCode. In this video, we're going to take a look at taking services or shelter away from people through barring, banning, service restrictions, trespassing, any mechanism that denies people services after they've had access to the service. This is usually related to behaviors that are deemed to be unacceptable. We're going to look at the rationale of why organizations do that sort of activity, considerations if you do need to go down that road, and in particular, how we can use data and evidence to improve this part of our service delivery. Recommend that you start with your data. If you're not collecting this data, you really should. This is data related to every single time a service restriction, trespass, ban, bar, or denying of service of any sort occurs. We want to start with that data, understand what are the main reasons why people within your service or your shelter are being asked to leave, how long they're being asked to leave for. We also want to look at a few other components. One, from an equity lens, are there certain people that are being denied service more frequently than others? In particular, we would recommend that you do some sort of racial ethnic analysis on that, as well as an age analysis on that. The next thing that I'd say that you should look for in your data is whether or not there are particular times of the month that these sort of instances increase. This in some communities has been directly related to when people get access to financial resources and behaviors that are attributed to substance use during those periods of time. I'd also recommend that you take a look at which staff are responsible for issuing these service restrictions, barring, banning, trespassing, or denials of service. You can sometimes find that there's particularly staff members that are more inclined to issue service restrictions, barring, banning, etc., than others. This could point to just what is a fact of life of the role that staff person plays within your organization, but might also point to opportunities for training. Great question, and one that not every organization thinks through. From the outsider perspective, sometimes it seems clear that what is being done is punishment. Other times it's intended to be a method of rehabilitation. Sometimes it's about addressing safety. Sometimes it's just plain ignorance. I think we have to look more intentionally around when is it justified, when is it not justified. So there's general consensus that taking some sort of action is important and necessary when there's safety risks, particularly matters of violence, sexual harassment, racism. In other instances, we look at things like whether or not the individual that is being denied service has committed theft or damage to the property. You're really only going to know when it's justified or unjustified, though, if you take a look at your rules or expectations and compare what those rules or expectations are relative to how people are behaving within your service environment or your shelter. Many organizations make the claim that they're person-centered, strength-based, and trauma-informed. Then you look at their rules or expectations, and they're anything but. Do we want staff to be in a position where they're helping people meet expectations? Or do we want staff engaging with guests, service users, and policing their behavior? Another way of looking at this is the intention of your program, your shelter, to provide a social service, or is it to exercise social control? If it really is about providing top-notch service, and you do truly believe in being person-centered, strength-based, and trauma-informed, then let's pay attention to the power dynamics that exist within rules and the enforcement of those rules. It's entirely possible that you are barring, banning, restricting services of people because you have a rule that people cannot meet. Or there might be an alternative to getting the same results in a different approach. Beware when you go through this process that you likely have some blind spots. Again, look at your data relative to service restrictions, but you also would be well benefited from having frontline staff and your service users, your program participants, your shelter guests, also go through a review process of your rules and expectations to let you know which ones are much more difficult to follow, why it's more difficult to follow, and what suggestions on improvements they might make so that you spend less time having to restrict service, bar, ban, or trespass people. Okay, and how are those working out for you? I can tell you, based upon analysis in lots of communities, that when you go down the road of saying we have behavior contracts, 3 strikes and you're out, warning systems, that in almost every instance it's a countdown to when the person is going to be asked to leave. They don't work particularly well for people with brain injuries or diminished cognitive capacity. They really are an exercise in control. Might I suggest that instead of going down the road of having people sign a piece of paper saying they're not going to do something again, that instead you engage in a social service solution? How can we support you so that this doesn't happen again, rather than delivering ultimatums? Start with an examination of self, that individual worker who's in that situation where they think they do need to issue a trespass, bar, ban, or a service restriction. One of the organizations we work with has come up with a great 5-question filter for staff to go through before they issue any sort of service restriction, barring, or banning. They are as follows. Have I removed my personal feelings from the situation? Have I assessed my own mental health and where I'm at prior to issuing this bar? Am I aware of my own personal triggers? Did I tap out when I should have? Did I consult with a colleague, supervisor, or manager prior to issuing the service restriction? 10 minutes. That's often all it takes to get people to redirect, pause, calm down, try again. Before you go issuing that 1 night out of the shelter, or 5 nights, or 7 days, or 30 days, or whatever it is, could you resolve the same situation in 10 minutes or less? If you just requested that the individual leave the property, go for a walk around the block, give you a chance to calm down, center yourself, and try re-engaging. Maybe not for the really serious stuff, but for all the little things that escalate quickly, sometimes 10 minutes is all it takes. And in those 10 minutes, they have a chance to re-engage with services in a way that is going to be effective for them and in a way that is going to be much easier for you. Whenever possible, we want to progressively engage in this space as well. Think of it as the least restrictive approach to dealing with a particular issue and then elevating or escalating from there. So if an incident is occurring and we can redirect, we can de-escalate, we can solve the situation without requiring some sort of service restriction, that's always the first choice. From there, we might have to deny services and a shelter for the night. If we have to do that and you have more than one shelter in your community, let's try to make sure that person has a safe place to go that night. So if they can't stay at your place, they can at least stay somewhere else. Once we get beyond that, when we get into several nights or an entire week or a month or even lifetime bans, it becomes a lot more difficult to see how this is rehabilitative rather than punitive. It's hard to see that there was just a safety consideration when it manifests itself into something that jeopardizes the safety of the individual, perhaps for the rest of their life. It might also increase unsheltered homelessness and have other sort of community impacts that were not foreseen when you went down this road. It's got to be for remarkably rare events that you would ever get beyond that 3, 4, 5 day period. Usually repeated events, but even in those sorts of situations, you got to ask yourself, what are we doing differently to support the person in the space, rather than putting all the onus on the person to change their behavior to meet your needs without any support? Individuals benefit from guidance in meeting expectations rather than being policed for their ability to meet your rules. I'll start with repeating myself a bit. Have expectations rather than rules. This isn't semantics. Expectations are socialized, rules are enforced. You could find yourself having to engage in service restrictions, barring, banning, trespassing, etc., because your rules as constructed leave you no wiggle room for how you go about addressing these situations in ways that are safe, person-centered, trauma-informed. The next thing I'd really encourage you to do is examine your professional development amongst your staff team, ensuring that all staff are trained in de-escalation. All staff are trained in anti-oppression, in particular being anti-racist, and making sure that all staff are trained in trauma-informed care. From there, you may need to look at different aspects of your service delivery makeup. So for example, in a shelter, you may want to revisit how you do intake and how those expectations are shared with people. You may want to look at staff contingencies. Are they present? Are they proximate? Are they making the rounds? And a lot of times when staff are sitting behind desks, they're responding to a situation before it's too late, whereas they could have been proactive by being present and proximate with people, de-escalating before things reach a fervid pitch. You might also, within the space, give some consideration to having a peer organization. Look at your policies, look at your procedures, engage with some of your guests or service users, and come up with recommendations to you on how this can be more fairly implemented in terms of expectations and recourse for individuals and staff. I'd also really strongly urge you to have a well-established, fair and transparent grievance policy, so that if people are in disagreement of how these particular expectations or rules have been enforced, resulting in any sort of amendment to service, that they have recourse of how they can reactivate their service without having to beg or grovel in order to get access to those services again. Please, whatever you do, don't lose sight of housing in all of this. Our reason for existence is to help people exit homelessness into housing. We don't want to perpetuate someone's homelessness or give them a life sentence of homelessness because they've been denied the very services that would help them exit homelessness. This doesn't mean that there won't be some trying times with some very difficult situations. But if we keep the problem fixated on how do we assist this person so they can achieve housing and engage in behaviors that won't be problematic for sustaining their housing, we will be much better off as an organization and as a community if we continue to take some very high needs individuals and assist them in accessing the solution to their homelessness.